Hi, my name's Mazda Turel, and I'm a neurosurgeon at Wokhart Hospitals in Mumbai Central, as well as an assistant professor at the Grant Medical College and Sir J.J. Group of Hospitals. Today I'm going to talk to you about how can one prepare for brain surgery. Once one is diagnosed with a problem that requires a brain operation, you could be either having a brain tumor or a vascular problem in the brain or refractory epilepsy that requires something called as a craniotomy. It can be pretty unnerving for the patient as well as for the family. We usually do all investigations on an outpatient basis and ensure that the patient is fit for surgery. They undergo a pre-anesthetic evaluation and make sure that all their blood tests are in order. We typically use something called as neuronavigation at surgery, which enables us to approach the exact location of the problem in a three-dimensional space and guides us towards that location. A lot of patients ask me if their whole head is going to be shaved before surgery, and usually that's not the case. We just shave a strip of hair along where we make the incision. So what typically happens is patients get admitted one day prior to surgery. The anesthesia doctor takes one final look at them to make sure that heart rate, blood pressure, everything is under control. And the next morning, they're wheeled into the operating room. The anesthesia doctors will hook you up with certain monitors, the ECG leads, etc., before putting a tube down your throat to give you something called as general anesthesia, wherein which you're unconscious throughout the operation. There are some operations wherein which tumors are located in eloquent areas of the brain, and we need patients to be awake for that so that we can check their motor functions. And actually, we can do the operation when patients are awake and talking to us and moving their hands and legs. And that's something called as an awake craniotomy, which requires a slightly different preparation. The operation takes place under extremely sterile conditions, and everything is cleaned and draped in a very systematic fashion, the protocol of which is completely standardized. We make a skin incision and usually using a drill remove the part of the bone that is required to be removed. Then there's a covering of the brain called the dura, which is what we cut, and then enter the appropriate space and deal with the pathology. It could either be a tumor, it could be a vascular malformation, it could be anything that requires to be removed or transected or disconnected. Usually brain tumor operations last for about 3 or 4 hours on an average. It could be longer depending on the case. What happens is once we've dealt with the pathology, we close that layer of dura back and we replace the bone flap and we fix it with plates and screws. Patients are more often than not extubated immediately after the operation in the operating room itself. Very rarely, if the operation is really long or there is a lot of blood loss, are they kept overnight on a ventilator and extubated the next morning in the ICU. Typically, they are wheeled into the ICU for about 24 hours after surgery, and most patients who undergo a brain tumor operation are started on an oral diet 6 to 12 hours later. Most patients are ambulated the next day and are out of bed, and we usually try and remove any excess intravenous lines. We remove the Foley catheter, and we encourage patients to walk on day one after surgery. This is actually quite revolutionary compared to the myth that people have that patients after brain surgery remain in bed for several days and are not allowed to do any kind of activity. We actually encourage all our patients to get out of bed as soon as possible, and that helps in prevention of deep vein thrombosis, helps in prevention of pneumonia, reduces chances of infection. Typically, patients stay in hospital for about 3 or 4 days, depending on the case and the operation. And we generally send them home and call them back for suture removal anytime between 7 to 10 days. Microneurosurgery has become pretty safe and effective nowadays, and the success is more than 95%. There are some complications that happen in 2 or 3% of patients, and these could include postoperative seizures, Sometimes there can be a postoperative hematoma which requires evacuation. Sometimes there can be brain swelling that requires removal of the bone flap. And sometimes that may be a neurological deficit that may be transient more often than not, and sometimes may be permanent, depending on the location of the tumor. However, now that we've progressed and evolved and we have excellent neuroanesthesia, we have excellent intraoperative monitoring, we have excellent neuroimaging, the rate of complications are going down year by year. And the mortality rate for neurosurgical procedures is about 0.5%. There are some operations of the brain that we do through the nose. And that procedure is called an endoscopic transsphenoidal surgery. And usually it's reserved for tumors in the region of the sellar or suprasellar area. These tumors are either pituitary adenomas or craneofaringiomas or suprasellar meningiomas. So the same tumor that was once accessed from above transcranially can now be removed through the nose in a very systematic and standard fashion. We usually do this with the help of our ENT colleagues who give us access through the nose to the tumor, and then once we reach the tumor, we remove the tumor or whatever the underlying pathology is, and then the ENT colleagues help us repair the skull base defect. Typically, these patients have a nasal pack kept in for 2 or 3 days, and again, their length of stay varies between 3 to 5 days in the hospital, sometimes a week. This, in general, summarizes both transcranial and transnasal procedures for various forms of brain pathologies requiring surgery. If you need a further and more detailed insight into your particular problem, you can visit my website www.mazdaturel.com, and you'll have a plethora of information, including videos and booklets and frequently asked questions to completely put you at ease before you undergo any kind of procedure. Thank you.